to talk about rewiring healthcare, how MarTech is powering the next generation of patient experience. Ladies and gentlemen, join me as I welcome the Group Chief Marketing Officer at Narayana Health. Please put your hands together for Dr. Ashish Bajaj.
It's definitely the dead session. We can at least have a little bit of more clap, please. Louder, guys, louder. Open up your eyes. I know the food was good, and it's one of the reasons I also go to the events because of the good food being served. But yes, coming back to what and why I'm here. It's about a lot has been spoken about of late since COVID. Healthcare has become the main front. It used to be something which was held back at some point, saying, okay, when it is required, I'll go. But I'm researching more about it as a consumer. I'm giving much more billion impressions to somebody like me to capture you. So in that case, it's become the talk of the town. And now let's add MarTech to it. And let's even complicate things more. So that's what we marketers do, right? Until unless we complicate it, nobody's going to come to me and say, what are you going to do and how are you going to solve it for me? Though the business guys knows it well how to drive business, but we are the fancy ones. So what we talk today about is something that brings in a little bit context of healthcare, how you can bring in the marketing and technology stacks together. And just to promote myself also, I've launched a book on that, and it's a clear playbook with 6 chapters, which can actually allow you, if you're moving from 0 to 1 for your entire organization or your own startup, or you are somebody who's aspiring to be a digital marketer, it's an easy guidebook for you where you can understand how to set up your MarTech stacks and what are the kind of KPIs, JDs, etc. to be written on it. So moving on, what's happening in healthcare? And I'm sure there are not much is happening. Why? Because you are not just like Zepto is telling you what you need to buy today, or how Swiggy is telling you what you need to eat at 1 o'clock. Healthcare brands are not telling you how to take care of your health. So that means even with knowing what is happening on your entire 8,000 markers as a personal individual user level, which is either your heart rate, BP, etc. So these are like 8,000 plus markers which get captured when you do a health checkup. It depends on what kind of health checkup you're doing, but that's the extent of it which can capture. So that means it's already data rich, and it is to a level for every person, it's different. So that means there are gaps, because if you're not able to channel it well and land it back to the consumer for his or her benefit, that means you're losing out. So data fragmentation is the biggest problem right now, because the health checkup data is not talking to something which needs to be connected back to the doctor so that the information flows to you what needs to be done for your better health. Now tomorrow, if there is, let's say, the health checkup has not come out all green, it's red. What is happening? Are you getting a call back? People telling you what needs to be done for your better health, what you need to stop, until and unless you yourself are taking 50 minutes more to sit down with a doctor. तो डेटा तो इसका मतलब बिल्कुल फ्रैगमेंटेड है. जब फ्रैगमेंटेड डेटा होगा तो कम्युनिकेशन कभी आएगी ही नहीं आपके पास. It's not about information coming directly to you. Plus, a lot of healthcare brands, I'm not saying all 100% of them, there are a lot of them which still don't believe in technology. Technology is a cost for them. So they are still living in Pentium 1 era, and they don't want to move away from it. Before I come to this, I think when you talk about healthcare gaps, I'll take this up a little notch up and 30,000 feet up. And this is now the 4 Ps have absolutely changed. Up ke liye, if you want to, from now onwards to going next 3 decades, it has to be about platform, process, people and performance. कोई नहीं मैटर करता प्राइसिंग क्या होनी है, कोई मैटर नहीं करता प्रमोशन क्या होना चाहिए, कोई मैटर नहीं करता प्लेस क्या होना चाहिए. Why? Because the minute you are able to land the platforms right for yourself, data silos, fragmentations, basically, if you finish those data platform issues and you are able to scale with processes being automated and your teams trained well. And I'm very proud of saying that my entire middle management team and the marketing team are all trained on AI now. And they only have to figure out how they're going to use AI for the better of the work that they are doing in their fields. So whoever is working on the brand, whoever is working on SEO, whoever is working on website, whoever is working on social, they need to figure out after getting that training how they improve their day-to-day work and their own efficiencies. So your people and people training and how you write your own JDs to be hired in your teams is something that you need to change. So it becomes very important for, I think out of the all four, my favorite is people, because post that everything works out very well. Performance. If you're going to get stuck on ROSs, you will not grow. If you are stuck on certain vanity matrices, you're not going to grow. But yes, I'm not saying from a performance point of view that short-term numbers are not required. I'm not saying why, because if you're going to keep building on saying that, okay, 3 years, after 3 years, I'll start seeing the results of this. Bhai, aaj ka dhanda nahi hua, company band ho gayi hai. So your monthly numbers are also absolutely important. So your performance matrices, of course, I like ROSs, but ROSs needs to be looked at much more holistically. Don't break it down on saying that मेरा Meta का ROS इतना और मेरा Google का ROS इतना, मेरा DSP का ROS इतना, अरे भाई मैं Meta बंद कर देता हूँ. Doesn't work like that. If I put effort into explaining why I'm saying, Meta gives you the quick reach, quick awareness. That quick awareness generates into your search keyword, search. Those search, you get a better CPC. Your conversions are much better in CTRs. There is a link. You need to understand that link. So, apart from just looking at these siloed vanity matrices, just move to a holistic performance, much more larger. And for me, the most core KPI that we measure is your NPS. If you're able to get it right, understand the problems, because entire consumer insights will come from there. Of course, you discount 60% out of it. People do not. Hospitality industry, they will push you to the core to give them 5 stars. So just minus those things out, minus the noise out of it, and you'll be able to understand and drive your business very well. So coming back, MarTech really what is today? We go too much gaga about buying, just like how men like to boast about the drive they do. So I have a Ferrari, I have a Lamb, all of those things becomes the tool. Now organizations like ours, we like to buy the most expensive products. Why? Because I will be able to showcase it in my board meetings. I'll be able to boost myself by saying that, okay, I have this much fancy product. The point really is how that tool starts talking to my marketing team in terms of understanding the output of it. It is not about the most expensive product. Plus, you should be able to bring together emotions and data. You have the data available, you have the creative side of your teams, you have the brand side of your teams, you have people who understand social very well, you have people who are part of your team who are into consumer insights as well. Plus, of course, you as leaders also do a lot of work in terms of synthesizing this entire data very fast. So, if for you, MarTech definition becomes, I'm able to use the tools properly, which is solving for my marketing problems, and as a brand, I'm using emotions and data together to launch meaningful communications. That's what you need to do. Of course, it's much complex than how simpler I made. So how are brands winning it? Of course, I'm very happy to say that there's a lot that we are also doing in healthcare, which is first. We are able to scale the personalization, our customer journeys at a much faster rate. We've even digitized, and even after our patient relationship management systems getting into basically the CRM getting into our call centers, we are helping our agents to increase their efficiencies. And if somebody say, is there incremental shift in your numbers? Yes, it is. My agents' conversions have improved because they are much more informed. They have ready information with them for things they were not able to get earlier. So they are able to provide consumers with much better information on how they need to process their disease management. Then becomes, because I've been speaking about how the personalization story becomes great. This personalization story has been in talks since the email marketing started. And we've been knowing that Nike does it very well. Adidas is copying what Nike is doing. And there are multiple brands who have done personalization. But I've never seen a brand which has done personalization at scale at that level. But now every brand can do. It's not difficult at all. Why? Because your understanding of the cohort, your understanding of your business remains with you. Now the solution at a tool level needs to be built strategically or solving customly for you. Post the minute example, Ashish has a problem which is for, let's say, BP. Somebody else, or let's say Mega, has a problem where she has a thyroid. But as a brand, I can't send them both a message which says 15% off on your next OPD. That's not what you want to do. That's not what's going to drive people coming back to you as a brand. That's not going to drive any website visits for me. That's something that I've killed Ashish and Mega as my future customers for sure. If I know that Ashish has a problem with BP, am I giving him information on how to control his BP at home? What is the kind of nutrition? What is the kind of food habits he needs to drive? And when in 3 to 4 months he needs to see a doctor? That's we call it as a program. That is very true for diabetes. That is true for people with thyroid. That is true for people who are recovering post a surgery. So imagine I have done a heart surgery for myself, but thankfully personalization engines don't work for me. And as a brand, I've sent you an SMS that your health checkup is due tomorrow. Which can be. The data silos are broken. There are silos, so the information is not passed on right. And I've done a blunder. Whereas the minute somebody is discharged from an IP, I'm giving them a 3 months entire program which tells them how to recover, when to speak to the doctor, and what is the food that they need to take. These are the basic consumer insights which people don't find when they get discharged from a hospital. I know how many of you have this kind of experience, but that's the truth. We spoke about, of course, the matrices, how we are driving the outcomes. सबसे बड़ा problem इसमें रहता है कि there is a technology cost, there is a team cost that gets added when you are building your MarTech stacks. So a strategic alignment not only at a matrices level, but at a spend level also needs to be done with your leaders in the organization or the stakeholders in the organization. Otherwise, it's always seen as a cost that is sitting on top of any marketing teams or any IT functions for the tools. And then you are just trying to figure out what is the ROI that I've got on spending 7 CR, for instance, in terms of getting the entire Ferrari for myself. So my idea also for launching, for releasing the book was also on the same thought process, because while I was doing it for Ola and Medibuddy, I was not able to get anyone to give me that kind of playbook. And we did all our mistakes ourselves. We burned money, we burned our hands. And what I've tried now is something that can help all of you in terms of building that case for yourself. And it's something that can help you do it yourself. You don't need anyone's help for that. And remember the last thing, I'll say it again. With AI coming in, humanization of creatives or customer journeys, there's a lot of conversation on it, whether that creatives looks good. I think Saurabh was also mentioning to that, and I am hearing a lot of conversations also that, oh, this looks so fabricated as a communication piece. I think if you're able to solve emotion plus data, it will give you the right impact. Let's not fret about it. And there are ways to guardrail your own brand guidelines, feed those brand guidelines, those engines, and you will be able to drive much better outcomes, which will show you a better CTRs, which will show you a better cost per lead, which will show you a better CAC. So I'll end it up here. I'm happy. I have 5 minutes. I'm happy to take any questions if anybody wants, or it has become too serious or you're already sleeping. Yep. Thank you.